All right, I want to share really quickly about our approach to measles when it comes to this growing outbreak across the country. And then we had a local case this week. We had some wastewater evidence last week. I just wanted to talk through what parents should do because we've gotten a lot of text messages from concerned parents. And there's a couple big things to know. First and foremost, measles is extremely contagious. So back in the COVID days, everyone talked about the R naught. If you're in a room with people, and somebody's infected, how many others are going to get infected just by being present in the room with it, sharing the air and those sorts of things. And the R naught for COVID was like 1.1, 1.2, under 2, somewhere like that. If you're there, you're going to spread it to one other person, maybe 2 other people, depending on conditions and all those sorts of things. The R naught for measles, and we know this because measles is essentially eliminated by and large in the U.S., except for these recent outbreaks and our status is at risk. But around the world, measles is still often epidemics from place to place throughout the world. So we know what the R naught is, and the R naught is like 10, which means if one person is in a standard sized room for a bit of time with other people, the unvaccinated people, one person can spread it to 10 others. And so it's extremely contagious. It's actually amongst the most contagious viruses known to humankind. And despite that, we haven't had a case of measles in Lancaster County since 1990. And that is a reflection of herd immunity protecting everybody. The vaccine is really effective. Once you've gotten the vaccine, you essentially are protected and you don't have to worry about getting measles. And so as we talk through, that's the calculus that we're working from, is there's a couple different layers of people. Those that are vaccinated, your child has gotten their first dose, and if they're of age 4 to 6, they've gotten their second dose of measles vaccine, or you're an adult and you had measles vaccines as a child, considered protected. Keep calm, carry on with normal life. Attend activities, go to the grocery store, all of those things that are the normal daily activities of life, unbothered, unconcerned. Obviously, this time of year, like everybody has the flu as well. So it's not like you're not going to pick up anything, but you're not going to pick up measles. And so you can keep calm and carry on. Now, for those children that are either behind on their vaccines, and we've had a lot of parents that our practice is a little bit different than some in town in that we have people that are not currently vaccinating, or they're going more slowly, or somewhere in between when it comes to their vaccines. We've had a lot of them reaching out and saying, okay, I wasn't ready and now I'm ready. And we just get them their MMR and carry on. For those that are not up to date on vaccines, those are the ones that are at risk. And so if that's you, I would have a conversation with your healthcare team about what to do here when it comes to all the normal activities. Now, we've only had one case in Lincoln, but like I said in yesterday's video, it takes 21 days for that incubation period to lapse, which means that one case a couple of weeks ago, there could be other cases still brewing. So we'll know in a month whether or not there were other cases or if this was an isolated case. The likelihood is that there are other cases brewing in the community simply because this was a person that didn't have any outside travel. And so they got it from somewhere. So there must be other cases circulating in the community, but we'll know about that within a few weeks. In the meantime, I would consider your choices when it comes to outside activities, large groups, especially if you don't know who else is present. Now, the trickiest ones and the ones that I feel the worst for are parents of children under 12 months of age, because typically we don't do the measles, mumps, rubella vaccine until they're 12 months of age. And then we get them their first dose, and then we get them their next dose when they're around age 4 to 6, around that kindergarten time period. Infants under 12 months of age, in some cases, can get the MMR early. And the typical approach that has been done mostly around the country is, if there's not a local outbreak, don't do anything. If there is a local outbreak, then look closely and decide, okay, they're under 12 months of age, but we want them to get protected because those that are at highest risk for hospitalization, dehydration, pneumonia are in that under 1 age group. And so that is the trickiest group that we're working with. And so the thought is, if possible, wait until 12 months of age. If you can't, give it to them early to protect them from getting measles, knowing that they'll still have to get their regular vaccine schedule at the regular visits. between 6 and 12 months of age, you can give the first MMR, and it is effective at preventing or protecting against measles at that age. There are some small studies that show that over the next few years, they might have lower vaccine efficacy, like continued protection. And so we might have to look into that as they approach kindergarten age. Do they still have protective antibodies or those sorts of things? But those are way in the future things. And we're trying to prevent measles right now. The thought is that there could be some immune reasons that we're not quite clear on as to why, if we give them a dose before 9 months of age in particular, that their immune system, whether it's maternal antibodies or some other facet of the immune system, that makes it so that they don't have as long and as robust of a measles immunity. But all of that is down the road. And that all is outweighed by the fact that we don't want those 9-month-olds to get measles. We don't want kids to have to go through measles and spread it and have it go through daycares in these infant and toddler rooms simply because we're worried about their future protection. So we're going to say, if you're younger, it still makes sense to consider the measles vaccine, especially if you're going out in the world and there's an outbreak going on. So that's the calculus. I don't know if that was entirely helpful or clear, but hopefully it's helped paint the picture that if there's an ongoing outbreak, it makes sense for us to consider vaccinating these children under 12 months of age. If they're between 12 months of age and any other age, and they're behind on their vaccines, it makes sense in the midst of an outbreak to get them their measles vaccine because it is effective and it prevents measles, which really sucks. All that being said, the biggest concern around measles was the study that has now been retracted that was the link between autism and measles. And because of that study, we have had so many follow-up studies. And if you are thinking, well, it hasn't been well researched, it has been extremely well researched because of that fraudulent study in the Lancet that started this whole controversy. So I rest easily, and I tell my parents and patients that I would never do anything to put them in harm's way or anything that I didn't think was safe and effective for them. And I, without reservation, say that the MMR vaccine is safe and effective and helps prevent measles. And so I would have no qualms about that. And that's the conversation that we're having over text message and having them in the office and phone calls and those sorts of things with families that have been hesitant, that are concerned about both getting the MMR and getting measles. And that is the calculus that we talk through with these families and get the chance to help them navigate these waters that it is unfortunate that we have to tread.